Well, hello folks, it's Janine, CEO, with a quick update as to where we are in the organisation. Firstly, hope you're well, hope you're taking care of yourself and enjoying the sunshine. We've had lots of it recently. So I've got 4 things to update you on. The first one is, for those of you who are not support practitioners and are getting £12 an hour, wanted to just let you know we've got a positive result of a 6% pay rise for the rest of those staff as a minimum within the central team. So that's a 6% pay rise for those staff within the central team. Do recognise that quite rightly, people working to support those in the community had a 10% pay rise, which took us to £12 an hour. Which means that we're all being paid at least the living wage. So please check in your pay packets. You should be receiving back pay to the 1st of April for those in the central team. Which leads me on to another money thing. So some of you who work within the teams will know that the individual service funds sometimes are just not balancing. The amount that's being paid per hour by the Health and Social Care Partnership is not enough to be able to balance to the outcomes and the activities that we want to do with and for the people that we support. So just to let you know that there's lots of us within the senior team having dialogues at the moment with the various health and social care partnerships. If there's any positive result, trust me, Jim and I will be back to tell you all about it. So that's ongoing at the moment. Another thing that you may have noticed, you saw an email from Paul Scovron, who is our chair of the organisation. That's about a role that some of you have been asking me about. So many of you who've been with the organisation back in the days of Doreen, back in 2013-14, will know we were an organisation of 45 people supported. Well, since that time, we've grown to 112 people supported. And the work that we're doing right now is beginning to catch up on some of the systems and the background support that keeps us safe. So you'll see the role of Director of Central Services has been advertised recently, and that role is a short-term role fixed for up to a couple of years to help us get to a place of ensuring we've got all the right systems in place to enable us to do the job effectively. Last but not least, the team across the organisation in the Kirk and in Renfrew are having discussions at the minute about getting person-centred planning back on track. That's some training that I know that many of you not had an opportunity to undertake during COVID. So you'll be hearing more about that in the coming months. Thanks for listening. More to come. Take care of yourselves. Bye for now.